but I just wanted to let you know about a project that I'm trying to run in a North Wales practice. I work with Dr McCadden, who I'm sure a lot of you will know is in the B12 world, so it's his fault really that this has all started. But I'm doing my Masters in Advanced Clinical Practice and I needed a research project. So I started looking at B12 because obviously as a nurse I'm responsible for administering the B12 injections. And I had a look at how many hours we actually spend in a year, and it's over 1,000 practice hours that we spend. So I started thinking, well, you know, obviously the patients have got to put in the effort as much as we have. And I know a lot of GPs' response to that is, oh, well, we'll just do it every 3 months and that will reduce our time. But really we should be looking at other solutions rather than just saying no to the injection. So I have a look at the sort of current research, the evidence and the historical research, and there's nothing actually that says it has to be IM that I can find. Parenteral is the historical injection route, which as we know can be IM, subcutaneous or IV, so it's nothing specific. I've been in contact with all the drug companies and neither can they give me any full evidence of why it's IM, only that that is their license, and if I choose to use it outside the license, that's my own fault. But they've got no solid evidence, so up until sort of a couple of weeks ago, I thought, well, maybe this is just me, pie in the sky. But obviously hearing Anna's talk today, that's encouraged me. And also there's a recent article being released regarding a subcutaneous catheter in neonates, which I know they're using as a daily, but whether they've been able to use the proprieties of that to turn it from the IM to the subcutaneous. And obviously, as we know, there's a lot of injections that are subcutaneous and they're self-administered, looking at the insulins. There's also a new depot that used to be IM and has now become subcutaneous. So I think there is an evidence for it there. My biggest problem at the moment is ethical approval, because obviously I'm not able to ask patients if they would like a B12 self-injection because there isn't actually a B12 self-injection available. So the thing I've been granted, which I'm starting in the new year, is any patients who come to our surgery, would they be willing to complete a questionnaire that asks about patients' attitudes towards self-injection and the reasons that they would choose to use a self-injection rather than come into the surgery. So really I'm hoping that this is just the foundations to a much larger project that I hope will become available in the future. And I say I'm just a nurse really, so I don't know anything about research or sort of the ethics and everything there, but I'm hoping to learn. So I just wanted to come here today, obviously, because you're all experts in your own field, and obviously your patients are the most important, and just sort of get any idea of whether people would be interested in a self-inject, and whether anyone thinks that it is something that we can take forward into the future. And obviously with the foundations of my literature search and the questionnaire, I hope that will give us some clarity and some clout to take forward and say, yes, this is something that patients want, that patients are willing to trial, and then obviously hopefully we can make that reality in the future. Thanks.
I have a friend who is now injecting, and she is a very nervous elderly woman who worries about going to the doctor, worries about everything really, worries about going to the shops. But she's been injecting, and the benefits that they bring to her outweigh any worries, and now she has no worries at all. So yeah. I think that if she can do it, she's 80, and it's given her a new lease of life. So I don't think it's a problem really for people.
No, lovely, thank you for that.
It's not a question really, it's just to say that has anybody that's buying the injections from abroad realised they are subcut injections? They're licensed for subcut abroad, but just not in the UK.
Abroad, yeah. Did everyone hear the question? Is anyone knowing that they're getting it is subcutaneous over the internet? Because it's outside UK licence.
Hello, I was just wondering why people with MS are able to do intramuscular injection pretty much every day, every week, and it's so it's so not allowed with pernicious anemia, and there's so much pushback on it. I don't understand what the reasons are. Is there anything?
I don't know.
You don't know?
I don't know, sorry.
Okay, cool.
I get my injections from abroad, and I've been doing it for ages, but I don't actually understand the difference between intramuscular and subcutaneous. Could you give me an explanation
So
of that?
intramuscular is deep intramuscular in that it goes into a muscle, whereas subcutaneous is literally under the surface, so it's just skin deep. So the reason that a lot of people don't do IM injections themselves is the actual administration is difficult to do because you have to be deep into your muscle, whereas subcutaneous literally just goes under the skin.
So I'm using a needle of about 1 inch deep. What am I doing?
Depends how hard you push.
Or does it depend how much fat I've got on my thigh?
It depends where you're doing it. It depends if
I'm
you're
doing-
actually lifting away from the muscle, or are you aiming to go into the muscle. If you're lifting it away, you're more sort of going under the skin. And
Just
you're
going straight into the muscle, straight
so you're
into the
going
thigh.
more into the muscle. You don't
Okay.
pull it away or anything like that.
Thank you.
Okay.
Is there any reason why people are not prescribed intramuscular self-administration?
I think it's just historically that it's very painful to do yourself. It can be quite difficult to, and I know people do it, but it's not something that healthcare assistants and professionals would ask people to do, I am.